Hi, everyone. My name is Anjana, and this is my partner, Eva, and we are the co-founders of PENY, the Patient Experience Navigator. So we first want to start out by explaining our problem. The patient experience includes everything from when a patient walks in the door to when they leave the hospital. We're talking about food delivery, cleanliness of hospital rooms, and interactions with healthcare professionals. Over 50 customer discovery interviews have shown us that hospitals are pouring a lot of money into the patient experience. But the current system remains inefficient, inadequate, and disintegrated. For example, food service uses paper feedback cards. Housekeeping only gets feedback if someone has time to stop by a patient's room. And most of the time, patients just end up flagging down a nurse to complain. The patient experience problem is further complicated by a growing financial impact on hospital reimbursement. Value-based healthcare ties 25% of hospital reimbursement from Medicare and Medicaid to the patient experience. We did the math and found that some hospitals are losing millions of dollars because they don't have good patient experience scores. So why is it that hospitals are losing out on so much money? The way current government mandated surveys are administered, it can take up to 18 months for hospitals to receive information on the patient experience. Stale patient experience data not only jeopardizes patient health, but also costs the hospital a fortune in lost reimbursement.
Our solution is PENY, a real-time patient experience analytics platform. The patient would use the app during their hospital stay. The data would be analyzed in real time, ultimately allowing for faster change, leading to better patient outcomes, an increase in hospital ratings, and better hospital reimbursement. This is what a sample patient interface would look like, where patients would be able to share their experience. Penny would ask questions that would measure mood, environment, relationships with healthcare professionals, as these have been proven by research to be the most important factors in improving patient recovery time and decreasing costs for hospitals. On the hospital side, the dashboard would be available to patient experience managers, food service, and maintenance leadership. Our software will continuously be analyzing data to detect common thematic problems and generate personalized recommendation reports for each department. Penny would replace that current inefficient, inadequate, and disintegrated data collection by being able to occur in the hospital while the patient was still in our care. Just think about this: real time analysis for real time results. We are currently piloting Penny at UPMC Presbyterian, and there is the potential to expand to over 7,400 hospitals, as 100% of hospitals are impacted by value-based healthcare. Using a business-to-business software as a service model, an average hospital of around 500 beds would pay $260,000 a year, yielding a $1.9 billion addressable market. Your investment of $2,000 would help complete software development for our MVP, which would allow for expansion and implementation into hospitals across the country. Our team consists of me and Anjana, along with our partners in the healthcare field, our mentors in the business world, and of course, our partners in the tech space. Thank you for your time, and we would love a penny for your thoughts.
I guess my question is around the gating factor. If their 25% of their reimbursement is based on patient satisfaction, is feedback really the issue, or is the issue that they can't address? It takes a lot of money to address the things folks are complaining about. And how is your customer discovery supported that feedback is the gating factor?
Yeah, that's a really great question. And we're actually trying to hit this problem from both ends. So our customer discovery has shown us that patients don't have a streamlined way of giving that feedback. So A, hospitals don't have a systemized way to collect that information. But B, like you just said, hospitals don't have a way of deploying an intervention in real time. Maybe because the questions can't be answered in real time, or B, because they don't have the data to do that. So our solution, Penny, kind of hits at both things at the same time. We want to survey patients on actionable items that the hospitals could intervene on, and then also collect that information for hospitals so that if they don't have an intervention in place right now, they can develop a solution so patients are satisfied.
Hello, entrepreneurs. I have kind of a two-part question, but they go together. The first question is, when do people usually take their survey?
So the survey, the ASAP survey, yeah, it can be administered anytime up to 48 hours to 6 weeks after discharge.
Okay.
So, and then patients have a year to complete that. So it can be a really long, like months and months after their hospital stay, and if they complete it.
Right. So that leads me to my second question, which is, how I've had major surgery, and I know the last thing that I want to do is be on an app, especially when I'm in pain. And for a lot of people, if they're in, drugged up, for lack of a better way to say it, and all these other kind of things, what would make me want to get on an app and say how I'm feeling if I just want medicine?
Yeah, no, that's a very valid point and one we've thought a lot about. And I guess with our solution, Penny, we want to be available for patients if they need it. So if they don't have anything to say and they're like, fine, and they need the medication and they need to just press the nurse call button, go for it, because that's how you get medication. But for the patients that desperately want to give feedback and something is wrong and they don't know who to talk to and the nurse isn't doing anything about it, we want to be there for them. And we've taken into consideration patients who, can't physically do that survey. And at that point, caregivers can we want caregiver input for Penny as well.
And I think another point of kind of why we hope patients would want to use Penny is that, this isn't dependent on when a nurse comes in and checks in on you, or when your doctor comes by or your resident comes by in the middle of the night. This is really in the hands of the patient, so that, whenever you need to give feedback or talk to someone or need to do something, that it's kind of there for you. And then Penny can kind of serve as the triage tool in further down the road of, okay, is this a food complaint, environment complaint? Is this, communication complaint, versus just ringing the bell and then the nurse comes and then, the nurse doesn't really know who to go to exactly.
My question is around competition. You talk about a platform that is analyzing data in real time and may have an ability to, provide immediate feedback. Let's just say for a second, a food tray was poorly handled, or the food was cold or something, and then, maybe the manager of the food service stops by before the patient's discharged and says, apologize for that, but we're going to do better. Where do you see the competition, and how can you actually? Do you have any idea from the pilots that you're working on as how you can actually, achieve some of that reimbursement in the value-based system?
Yeah, so we've done a competition analysis of like over 60 companies in the patient experience area. And the main things we've been seeing are that a lot of them are like for pre-hospital, like pre-appointment reminders, or discharge stuff. There's not a lot of tools for the patient in the hospital right now. And that's why I think where we kind of think that Penny is unique, that it's for the patient in the hospital, as mobile. And then the main thing, as you said, is this real-time, analysis and results. Which we're still conducting our pilot studies to kind of really make sure that we're asking the right questions, and more importantly, that we can act on the data from these questions.
Thanks for the good presentation. It seems to center around complaints. If I'm running a hospital, I want to know good news too. How do you incentivize patients to give you positive feedback instead of, hey, things are great, just something actionable?
Yeah, that's a great comment, and it's something that we've been inspired by other tools in the patient experience landscape, and that's a kudos button. So if a patient is thrilled with their stay and they want to thank somebody for making a difference in their hospital stay, we do have a kudos button put into the Penny software. But based on our interviews with patients and whatnot so far, if they need to talk to someone, it's usually because there's a problem. Okay. And so we generally say feedback, but we would thoroughly enjoy positive feedback to give back to the hospital.